Good evening. Today we were just browsing through the comments which we have received for our previous videos, and in that one of the comments which caught our attention was this one of the viewer asking for what is hysteria. So in fact this word hysteria is a old terminology which was used by psychiatrists as well as laymen, and in fact this is related to diseases which occur in females. That's how this word is equated with the word uterus in Greek, which means hysteros. Uterus in Greek means hysteros, and that's why the common psychological problems which were occurring in females at that time, this rubric hysteria was coined. So hysteria, in the current day terminologies, the current day psychiatrists, we use different terms called as dissociative disorders. We also use another term called as conversion disorder. And in fact, there are other terms called as somatization disorder. So basically, these are all neurotic illnesses. Neurotic illnesses means those illnesses where the patient knows that he is suffering from this particular illness and he has got some psychological explanation for these illnesses. So in this, I would be educating you about these dissociative disorders, somatization disorders, and also conversion disorders. All this, here the common thing in all these disorders is there is some unconscious conflict in the mind, and this unconscious conflict, this psychological conflict gets converted into a physical symptom. So when the physical symptom is some pain symptom, or multiple pain symptoms, or multiple symptoms in the body where things like indigestion, or things like palpitation, tiredness, and things like suddenly the person gets unconscious without any reason. Dramatically he becomes unconscious, he or she, and after some time they regain their conscious. So in fact we don't believe that now these sort of disorders are only common in females. Dissociative disorders do occur in males and females. There is nothing like these are only diseases of females. So when a psychological symptom gets converted into a bodily symptom, then this is called as conversion disorder. Sometimes when it occurs there is a psychological conflict in the mind and suddenly the person becomes unresponsive. So these are this is what is called as dissociative unresponsiveness. Or sometimes there is a conflict in the mind. I'll give you an example of this lady who was always being hit by a drunkard husband. So whenever she tried to plead to the husband, he would not stop. So the unconscious conflict became so deep, one fine day, suddenly she says that she is a goddess whom the husband has lot of belief in. And she gets possessed by the goddess and she starts behaving like the goddess. So this is what is called as dissociative possession state. So this lady, initially this husband became very afraid and there was a gain for this lady because he stopped hitting her. And it's not something which she deliberately does. But what happens is, so whenever he comes home drunk, she starts developing this possession state. So it is basically some conflict in the mind, that fear of being hit, the conflict being that she cannot overpower him, she cannot complain to anybody against her husband. This gets converted into what is called as the possession state. So some people even get what is called as dissociative motor disorder. Suddenly something like a fit, hand movements, or some voices they make, and suddenly it stops after some time. And it's not a fit. In fact, none of these symptoms will be neglected, or we never make a diagnosis of dissociation or somatization or conversion immediately. They will be investigated by various doctors. Despite doctors doing lot of investigations, they are not able to find out the physical cause. Then they attribute that probably there is a psychological cause for this particular symptom. And this is where general medical doctor may refer the patient to a psychiatrist. Very rarely they come to the psychiatrist. They become very resentful when they are referred to a psychiatrist. And of course they do not come out, they are not forthcoming with the gain they have. They keep, and because many times they don't know what is the gain. This is what is called as the secondary gain. It's not that it's very obvious. They are not acting. Please understand this. They are not malingering. They are not doing this deliberately. They, in fact, the only way out from their unconscious conflict is these symptoms. So these symptoms occur dramatically and suddenly resolve by itself. And in fact, when these symptoms occur, suppose unresponsiveness, or there is movements of hands and legs just like a fit, but it is not a fit. The video seen by the neurologist, or even a video EEG, telemetric EEG done, does not show any fit, any epileptic waveforms, but these things are occurring. So many times the doctor will refer you to a psychiatrist. So what you should understand is these sort of diseases, they require counseling. Counseling is the mainstay, because we have to find out what is the hidden thing in the mind. So many times the clinical psychologist or a psychiatric social work consultant spends a lot of time with these patients, talks to them, then they come out with their conflicts. Many a times even that is not possible. Then of course sometimes medications. And in fact, what is our observation is, many of these people with dissociative disorder in their childhood would have a history of childhood sexual abuse. Not everybody, but many of them. So this is one observation which is often made. So basically that abuse might be the precipitating factor for their getting these sort of attacks. And of course, many a times there will be multiple vague symptoms. This is what is called as the somatization disorder. There are or undifferentiated somatoform disorder. There is a weakness. There is this indigestion. There is this headache, backache. Sometimes they do not follow the normal anatomical pathway. You cannot, when they tell you the pain, doctors realize that it does not like suppose certain nerves are responsible for pain in certain areas, but the way they are described, it's quite vague. In fact, many a times we feel it is vague. Many a times maybe because our understanding is vague. Actually, patient will be trying to convey something. So these patients who have multiple symptoms, and despite investigations nothing is revealed, despite reassurance of doctors, still the symptoms continue. Such people, we call them, in fact this is the coming under a criteria called neurotic and stress related disorders in our international classification of diseases. So these diseases, that is dissociative disorder, conversion disorder, somatization disorder, undifferentiated somatoform disorder, all these were in olden days called as hysteria. In fact, there were people who thought any type of psychiatric illness in female they used to call hysteria. So hysteria is a very old terminology. It has a very broad set of conditions, and most of these conditions currently they resolve mainly by counseling. Counseling is the mainstay in the treatment of these sort of disorders. And of course sometimes family therapy, I have to add, many times the adjustments in the family are not good, communication in the family is not correct, there are a lot of differences of opinion in the family. So in such families, these sort of dissociation, somatization, undifferentiated somatoform disorder, conversion disorders, these are common. So I think I'll stop at this. The basic thing is, this is a channel which we are operating only to create awareness on various mental disorders. Our aim is to create awareness so that you accept when you are ill, analyze about this illness and take action. That is, go and visit a mental health professional wherever required. But please understand, this is not a substitute for any professional advice by a psychiatrist. I request you, whenever there is a need, when you are having sleeplessness, when you are having feeling of hopelessness, worthlessness, you feel suicidal, or there are multiple vague complaints which your doctor is not able to find reason for, or you have some abnormal movements which occur especially in public, and it resolves on its own suddenly, it occurs dramatically and resolves suddenly. These are conditions which require psychiatric help. Please take help of a psychiatrist. So this is a joint project of A.V. Baliga Memorial Hospital, Udupi and One Good Step.